So if you're looking at why markets are not down when there is chaos and when the COVID crisis has reached a dangerous level, well, that's because markets are saying that the economy is healing, economy will continue to heal, it's a matter of time, things will settle down. But let's understand the ground reality, the preparedness of the hospital, the fact that the numbers are now reaching dangerous proportions even in northern part of India, Uttar Pradesh, Madhya Pradesh. What is happening? How exactly is the healthcare infrastructure gearing up to deal with this dangerous and the second wave? And to discuss that and to discuss all that and much more, it gives me great pleasure to bring on board Dr. Ashutosh Raghuvanshi. Dr. Raghuvanshi, on behalf of the Times Network, a big thank you to you, your hospital staff. They are working round the clock. They are relentlessly putting their best foot forward to protect Indians and to save lives. They are putting in selfless work. So once again, a sincere gratitude for that.
Thank you, Nikunj.
Dr. Raghuvanshi, my first question is that when the second wave came in, nobody was prepared for this kind of a, for this kind of a spread. At Fortis Hospitals, since you are an all India chain, what quick steps you've taken, how many hospital beds you've added, and is your preparedness now better than the first wave?
There are certain similarities and certain differences from the first wave. The first wave also came suddenly, and hospitals and the system in general was not prepared for that. And at that time, there were several unknowns, especially in terms of what kind of therapies are required, etc. And hence the supplies were very much in question. And the total lockdown was also there, which made even more challenging logistically to get the material and people moved across the network and to the hospitals and back from the hospitals. Whereas this time the situation is very different. Though it has happened suddenly and probably hospitals and the whole system was not well prepared, but there were certain major differences. At that time, because of the total lockdown, the non-COVID work was not there. Whereas this time, the non-COVID work had gradually creeped to near normal in the month of March. So at that point of time, when suddenly this overload of patients started coming in, that was certainly a challenge. However, what is different this time is that the hospitals are more prepared with the supply chains. So that's a good part. However, the situation regarding beds is becoming critical, though the non-COVID work is gradually coming down because the elective work is not happening and patients gradually are getting discharged from the hospitals. However, the strain is very, very visible. We earlier had dedicated about 1,300 beds. The occupancy on that had come down to as low as 200 beds, which again has gone up to a full 1,300 beds. Almost 100% of those beds are occupied. We are trying to create temporary capacities within our hospitals and also dedicating some of the areas which were meant for non-COVID to the COVID patients. By doing all that, we would be able to increase the capacity by at least 50% more. But that may not be adequate. My fear is that the spreader events are still happening. The COVID appropriate behavior is not to be seen in major gatherings all across the country. And my fear is once that starts spreading, the infrastructure may be very inadequate in spite of all these measures.
Dr. Raghuvanshi, if I look at the sheer number, while we can feel slightly relief that the mortality rate is not there, but the sheer number is so strong that irrespective of what good work hospitals are doing, we will still be falling short on infrastructure. Is that true? Can I put it very simply?
Absolutely, you're absolutely right. And that's our fear, that the infrastructure will be grossly inadequate. However, government administration is taking a lot of steps, both in Delhi as well as Mumbai. I'm aware a lot of hotels, convention center, etc., have been drafted in to create temporary infrastructure under the supervision of some hospitals. So that is an appropriate step which has been taken. For now, that should suffice. But if the numbers keep on increasing at the pace and the super spreader events are not controlled, I'm afraid that there may be a huge mismatch in what is required and what is available. And as we have all seen visuals of political rallies across the country, along with the religious festivals and social festivals, I think that has to stop. If that is not controlled, we are in for a bad phase.
Will it get bad, terrible, and horrible? Will it get better, or there are chances of it getting contained?
If the spreading gets prevented to some extent by limited lockdowns or just COVID appropriate behavior of masking and keeping the social distance, washing hands, etc., the simple measures, if people start following that, I think within 3 to 4 weeks, we could start seeing this phase to start regressing. However, if those events are not stopped, then I'm afraid it may become worse, and it may not become, it may take much longer to get towards a normal cycle. Every peak eventually sort of fades. But the problem is how long the peak stays. How does it become a plateau and stays for some time? Which is a worrying thing, because in the events where people are not following the social norms are still going on at a large scale all across the country.
Dr. Raghuvanshi, the big difference, what I understand, is that this time this virus has hit middle class and upper middle class. And that is making it very challenging, at least for private sector hospitals, because everybody wants a bed there, everybody wants the best of the doctor. I'm not trying to, say anything in terms of in perverse manner, but I'm just trying to understand, is it true what we understand and what we hear?
No, certainly, viruses and bacteria don't discriminate between social class. So everyone is having it. Now the incidence is just so high that you are seeing all classes getting affected equally. And that is something which is nature's cause, and that is true that currently upper classes also have large number of infections. To be in order to really put this in perspective, in the hinterland the incidence was not high even during the first wave, which probably this time is not going to be the case. Events such as political rallies, Kumbh Mela, etc., will spread it to the hinterland. So I don't think that there is a specific class of people only which is suffering, but the sheer number, the volumes are so high that in spite of a relatively better recovery, etc., we are going to see more mortalities and more people suffering.
Let me ask the CEO of Fortis now to explain it to our viewers and to your shareholders. Your stock, in a sense, of late has been mighty excited. When the first corona wave had hit us, the first wave, it in a sense jammed the non-COVID business for hospitals. People were scared to go for surgeries. The protocols had to be followed. Is there a difference this time, sir?
So definitely there is a better understanding of the disease management. The average length of stay for COVID patients is less. We are able to segregate the hospital into COVID and non-COVID areas much better. And because of that, I think the impact on the actual business is going to be very less compared to the first wave. That is our feeling. And also we have rationalized a lot of our costs. We have rationalized a lot of our operational areas, and our logistic is much better. And because of all that, we feel that this time there may not be much impact on the financial health of the hospitals. Though the price control which is there in terms of COVID patients is still there. Some of that probably requires to be a little more rational. However, for now, it is probably required, and we are well prepared with that. And we feel that in spite of all those restrictions, we should be fairly all right as far as our performance is concerned.
But if the crisis increases, I understand that there are some hospitals which you've already dedicated to COVID. For example, the Shalimar Bagh Hospital in Delhi. Do you see that that could change, especially in states like Uttar Pradesh? You've got a large facility in Noida, in Maharashtra, you've got a large facility in Mumbai and in Mahim. Could that change, sir?
So we don't know, but I think the hospitals are already dedicating the largest possible number of beds. So a further enhancement of beds within the hospital is unlikely to happen. Non-COVID patients also have to be taken care of. There are cancer patients, chronic kidney patients. They need care as well. And there are going to be large number of mortalities in that segment if we don't continue to provide that care. So what probably will change is that additional infrastructure will be drafted, as I said earlier, hotels and maybe convention halls, marriage halls, etc., could be converted into some kind of a COVID accommodation, and the hospitals would take care of those. So that may be a way to provide additional infrastructure. The hospitals have a limitation, and the rest of the patients also need to be taken care of. That is very, very important.
We were speaking to Abhay Soi a couple of days ago, followed by Dr. Vikram Shah of Shalby Hospital yesterday, and he said, look, COVID revenue is somebody nobody likes, but COVID revenue is a revenue. So if you're looking at it from a balance sheet standpoint, yes, COVID business is adding to the top line and bottom line. What is your sense?
I think they're absolutely right that any revenue is revenue. So hospitals have a lot of fixed costs. So if there is an additional capacity on a normal state, the hospitals run at a capacity of about 60 odd percent, 65%. So if that occupancy level goes up to say 85%, even if the average realization is poor, that is an additional kicker to both the top line as well as bottom line, because your fixed costs are taken care of in a big way. So at marginal cost basis, COVID business also makes sense. And that's why I said that in spite of the fact that the prices are quite regulated and some of them are extremely low, but still the hospitals are able to do this work simply because at the fixed cost basis, it makes sense for hospitals to increase their capacity and utilize their capacity to the maximum.
I'm not trying to draw you to anything specific in terms of an guidance, Dr. Raghuvanshi, but Fortis now also is following a model of where they are, in a sense, maintaining and running facilities. Your example in Dehradun, where you were maintaining a hospital. Would you be looking at expanding on that model, because your brand is a well-established brand now, it has expertise and it has really proven its track record in this COVID crisis. Is that something which you are looking at, taking forward, where you want to keep your balance sheet right, but you want to use your expertise?
See, the managing of facility is a very small part of our portfolio. We intend to keep it that way. We feel that the hospitals we manage completely and have complete control on is where we perform the best. So the first phase of growth which we are planning is expansion within the given network. And we will be adding about 180 beds within this year. And that plan is on track, irrespective of what the situation is in terms of the pandemic. We are going to add those beds. So these are within the given hospitals, and this will keep on enhancing over the next 3 years in order to add total of about 1,600 beds. We do look for projects outside of the existing network as well, but those would be specifically within the given clusters where we have a presence. We are not looking to grow geographically in newer geographies. We want to remain limited to the geographies where we are and consolidate a little more on that. The given the hospitals which we already run, there are possibilities of expanding, as I said earlier, to the tune of about 1,800 odd beds, which we intend to do over the next 3 to 5 years.
But with bed utilization, Dr. Raghuvanshi, which has fallen dramatically, and it's not a phenomenon which is there with Fortis, it's there across all the listed companies when I look at the data. Is there need for expansion? Because while the healthcare need is large, that's the macro picture, but theoretically at a private level, none of the hospitals in last 1 year, even pre-COVID also, were running at 70, 80, even 90% capacity. So are there more beds than actually requirement?
See, Nikunj, if a hospital is operating at about 80% occupancy, that means they require more beds because every patient doesn't go at the specific time. New admissions come all through the day. So the hospital at 85%, you can say, is 100% occupancy. So 55, 60% occupancy is decent occupancy for a hospital to function optimally. And any hospital which has an occupancy consistently of above 70% requires expansion. So the expansion is required. The number of beds is still less in the country. However, the problem is that the hospitals are concentrated in urban areas and the larger metropolitan areas. But even then, I think there is still a need for further beds to be added, and there is a very strong case to do that. Now, there is an optimal size of a hospital as well. So if you have only 100 beds, you still require the entire supporting infrastructure. And that same infrastructure can support 200 and 300 beds as well. So that makes the economics much better. So the larger hospitals definitely perform better than the smaller hospitals. So there is again a case for expanding the hospitals to an optimal size so that the ancillary infrastructure can be used optimally.
Dr. Raghuvanshi, I'm looking at a BSE statement where one of the most famous investors in Indian stock markets has increased his ownership or his investment in Fortis Hospital. Obviously, Dalal Street and investors are excited about the good work which you and your team are doing. So how will FY22 be different from FY21? FY22 was challenging. Revenue was all over the place. We were forced to act and react to the COVID crisis. How do you see FY22? Things will start normalizing for you.
So the way the pandemic is peaking in its second wave now, it would be hazardous to guess how exactly this is going to pan out. Having said that, as I said in the beginning, this time the hospitals were better prepared. The understanding of the disease is much better. And we expect that there will be certain kind of stability in the non-COVID work as well. It may not be to the tune of what normal levels of such work is, but it would definitely be better than what happened during the first and second quarter of the previous financial year. So we are much more optimistic this time than what we were last time. We have fair degree of confidence that we are able to rationalize our costs as well, depending on the situation. And that gives us more confidence that we should be able to do a reasonable performance. On the other hand, the diagnostic industry definitely is getting a tailwind from the pandemic, and that is adding more revenue. Though it may be kind of a low margin revenue, but it is definitely giving them a boost. So that way, our diagnostic business is likely to do even better than last year. So that is our feeling at the moment. Of course, we have to keep our heads down and focus and support all our clinical teams to be able to deliver as good services as possible in these real trying times for the whole nation.
Two more follow-up questions, Dr. Raghuvanshi. When you say diagnostics, yes, just to bring our viewers up to speed with what Dr. Raghuvanshi is essentially talking about. He's talking about the subsidiary company SRL, which in a sense is a very large organized player in unorganized or a semi-unorganized diagnostic market. How much growth that business has reported, Dr. Raghuvanshi, and how much do you think that could contribute going forward to the overall revenue?
So overall, that would be about 25% of the total revenue as we go further. But the growth levels on diagnostic are in double digits last year as well. And I expect it to be similar or more this year as well. We have recently completed an acquisition as well. We expect that will give us a pole position in South India as well. So that will bring SRL almost like a true pan-India player with equally present in North, East, as well as South.
And just to wrap it up with one final question, Dr. Raghuvanshi, medical tourism. I understand that some of your hospitals, especially the Noida hospital, is completely state-of-art. It's one of the biggest and a specialist hospital in liver transplant. Was medical tourism a big business? Because if medical tourism was a big business, then that is unlikely to improve because of travel restrictions.
Yes, the international business was a significant business for us. 10% of our business was international. Some of the hospitals carried more of that business, especially in the two hospitals in NCR and a hospital in Bangalore as well, and some in Chennai as well. So that business is definitely affected because of the restrictions on travel and flights, etc. We currently are seeing about 50% of that business back. And we expect that for another year or so, that business is going to remain affected. And it is unlikely that it will come to the previous levels in a short time.
Well, Dr. Raghuvanshi, an absolute pleasure to have you on ETUNA, and once again, a sincere gratitude and compliments to the kind of good work, hard work, and the selfless work your team is putting forward so that all of us can really fight this COVID war. Stay safe, sir, and thank you for keeping India safe.
Thank you.